Good afternoon. I'm Tre Tailor, and you have joined another episode of Coping with COVID. Information updates. And
this is how we cope with COVID.
Exactly. That's what I was going to say. This is my reality, coping with COVID. This is my tailor-made life. You can hear the children in the background, the 18-month-old beautiful girl, the 4-year-old beautiful boy, who those of you who watch know that he has joined us in any level of undress. This is the time. He's so regular time. This is the time when he's got to go to the bathroom. And he's one of those, like, I'll get naked before I go to the bathroom. I don't know. It's so funny. My brother told me that he was that way as a kid. So I don't know. Maybe it's the DNA.
That's right.
Anyway, so a lot of you are going through the same things. You've got the kids at home, and hopefully we'll be in a situation where our world is at least some kind of normal, so these kids at least can get back to school. Don't know about that, but we are going to talk to State Representative Attorney Todd Rutherford once again today. Todd, thank you so much for joining us.
No, thank you for having me. Absolutely. And I've got a lot of feedback from the last interview we did.
Great.
Week. A lot of people calling in and asking follow-up questions and streaming this. So I'm glad we did this, and I'm happy we're doing it again.
Well, thank you so much. I really appreciate it. There were a couple of questions. I wanted to get back to that, but I also wanted to talk to you about the recent updates that the governor plans to announce today, that he's going to open a couple of other segments of the state. Flea markets, department stores, the florists, bookstores, music stores. He's not going to open up salons or gyms yet. He said he's going to wait to see about the safest mode to do that. But what can you tell us about the second phase? And I'm calling it the second phase because the first phase was over the weekend with the boat ramps.
So about the second phase, I spoke to the governor's office on Saturday, and they said that they had intended to do this. And again, I was happy that they did, because we have got to start opening back up businesses in South Carolina. One of the things that I realized is as people got their $1,200 stimulus checks, the only place for them to spend those $1,200 stimulus checks was in Walmart or Target, people that already don't need the money. We've got to make sure that other small businesses in South Carolina are able to take advantage of that and do so in an extremely safe manner. One of the things that we talked about on last week was the number of hospitalizations, and the fact that that is the number that I am using to kind of grab and see where we are. And the reason for that is because that 4,000 number that a lot of the press loves to keep throwing out there, 4,000 positive tests for COVID-19 out of 40,000 people total tested. The problem with that number is that a lot of those people got tested 6 weeks ago, a month ago, 3 weeks ago, and they are not even positive anymore, but we're not retracting those numbers. Right. I saw the article, we talked about it, that maybe as many as 2,500 people are no longer positive out of that 4,000, but that doesn't sell newspapers if you're going to use smaller numbers. Let me give you the numbers today. Last Friday, I believe we were at 345 thereabouts people in hospitals in South Carolina that were COVID-19 positive. And there were 44 hospitals that were housing those 345 people. As of today, you have 289 people in hospitals across South Carolina. No, I'm sorry, 277 people in hospitals across South Carolina out of a total 40 hospitals. Remember, we've got 65 acute care hospitals. Only 40 of them are housing people that are COVID-19 positive. Total number of ventilators, and this was not a number that I had last week, total number of ventilators in South Carolina is 583. Total number of occupied ventilators, 150, which leaves 433 available ventilators. And we've got 32 hospitals that have individuals currently on ventilators in their hospitals. That number does not break down how many of those people are COVID-19 positive. And we are, as of today, or as of April 18th, I guess we lose track of days, we are at 119 deaths total for COVID-19. With 160 new infections. So that being said, you can see why the governor is taking steps to try and reopen, because you have a number of people in South Carolina that are positive, but the vast majority out of 5.5 million is simply not. And for those people to be able to go about their daily lives that are not getting unemployment checks, that didn't get the $1,200 stimulus checks, I'm getting a lot of phone calls from those people as well, small business owners that did not get the PPP loans. So you've got a number of people that are waiting on the federal government to come through, but as usual, they're not. So the governor does need to take those steps to responsibly reopen, slowly taking steps to make sure that people are safe. And the only way to do that is to start testing out those things that allow people some degree of separation. Where I differ with the governor, and I'm going to put something out today on this, is to not allow local governments in these coastal areas to exercise their discretion in keeping poor people out, because that's what they're doing. What they're doing, and I just heard about this in Folly Beach, setting up checkpoints to stop anyone from accessing the beach that doesn't live on the beach. Well, again, the beach does not belong to Folly Beach.
Right.
The beach belongs to the state of South Carolina. And so either our mayor and other big city mayors need to stop residents of Folly Beach from coming into our cities, or we need to be allowed into theirs. That's the way that it works. I believe it is unconstitutional for them to prohibit people from taking a day trip to Myrtle Beach if that's what we want to do. We can maintain social distancing, and we have law enforcement authorities that should be able to do that. But what they should not be doing is exercising what I believe is going to amount to either racism or classism in keeping people off of the beaches of South Carolina.
State Representative Attorney Todd Rutherford is with us. I'm Tre Tailor. This is Coping with COVID. I'm coping with COVID with an 18-month-old and a 4-year-old, so that's why I'm going to...
I hadn't noticed.
No, and that's why I'm going back and forth, just for everybody to know. Hey, Todd, I want to come back to what you just ended with, but I want to go back, piggyback on some of the numbers, because as of yesterday, and I know you were updating some numbers today, there were 120 deaths. You did mention that. Confirmed cases, as you said, 4,377. 40,000 tests have been done with public and private labs. 10,000 of those were negative. 1,500 of those were positive. And of course, like you said, new cases Saturday, 165, new cases Sunday, 136. And healthcare professionals, DHEC does say that the infection rates have dropped. So we're talking about, like you said, department stores, flea markets, florists, which will be small businesses for the most, or bookstores, music stores. And and I know also that it's still going to be a number of people, a limit on the number of people that can go into those stores. I know this weekend when I was shopping, I noticed at a couple of stores, only 99 people could come in, depending on the, square footage and everything.
Well, if you were at Target, all 99 were in front of you in line, because I assure you, the line went all the way down the aisle to the back of the store and then turned the corner.
Yeah, no, I was in Roses. Nobody else go in Roses. That's why I went.
Well, it was clear that people had their stimulus checks and wanted to spend that money, which is why the government sent it out. And so they went, but there was no place open except for Target and Walmart and Roses, apparently. So,
yeah. So, and you make another great point about the beaches. So if people get out, they're going to want to go out. And like you said, in addition to spending money, they're going to want to go to the beach. I mean, we're a beach state. So how can the governor, who, as you say, said he was going to let those separate municipalities make that determination as to who can come on the beach and who cannot. How do we stop that? How do we, handle that proposal with your wanting to stop that from happening?
Well, what I worry about, again, is their way of stopping it is to make sure that the only people that can access the beach are the people that live there. And by and large, that's not going to be people that don't have access to large amounts of income.
Right.
And secondarily, it ain't going to be people that look like me. And so if that's the way this is going to go, he can keep them closed. Yeah. The other side of that is to make sure, again, that our law enforcement drive up and down the beach, which they do all the time, making sure that those families that are out there stay together and that they stay separate and apart from everybody else. But again, at some point, Trey, we've got to recognize that we can all live under the notion that my grandmother would say, boy, don't leave that house. Something going to happen. Right. You're hit by a car. Somebody going to shoot you, whatever it is. We all understand that that is a fact of life. But the reality is we also know that in South Carolina, even if our testing is off by as much as 100%, then we've got 8,000 people that are currently positive for COVID-19 out of a population of 5.5 million. At some point, we cannot sustain this level of closure. Yeah. You've got to be able to pay for the services that we're providing. Government has got to be able to pay for the services it provides. And there's got to be this balance. And this is a balance that we use every day in life. I was reminded the other day and watching Lil Duval's Instagram. And if you haven't watched it, it's hilarious and inappropriate for 90% of the people out there. However, one of the things he talks about is, being in clubs when he was younger and somebody starts shooting and you run out the door. Right. Well, that was a reality of mine. I went to Keenan High School and we went to a party and we stayed there until people started shooting. And it sounds stupid now, and it sounds stupid to people that didn't do it. And I would hope that we don't ever go back down that path. But the reality is that if we don't start to try to reopen and make sure that we are doing it safely, that this society as we know it is going to collapse, and that the economy as we know it is going to get even worse. The local calls I'm getting now are people that can't get unemployment, are people that can't get access to food banks. And so we are seeing that push, and we need to make it so that people can get back to work as safely as possible.
I want to say hi to Cynthia Watson and also good afternoon to Terry Wright. Thank you both so much for watching Coping with COVID. I'm Tre Tailor. This is Attorney State Representative Todd Rutherford. Alex Wright says, Todd, if no test kits, why open the country? I'm all for opening small businesses, but at the end, if there are no test kits, then why?
So here's where we are now in South Carolina. This is as of this morning when I checked with the Hospital Association. The numbers that DHEC is reporting in terms of positives are about 48 hours old. But you still have to remember those positive. If we got 160 new positives and 80% of those people went home the second they were tested, it's because they were slightly symptomatic and they were sent home that day. Out of that 160, so you figure 80, almost 100, over 100 people went home immediately. Some of those people went into the hospital. 80% of them went home or going home the next day. So you're still at a very low rate of hospitalization. To the degree that we're going to be able to test every single person, whether they are symptomatic or asymptomatic or slightly symptomatic, we are a long ways off from that. But where we are right now is with thousands of people trying to access food banks, and they can't get there and the food banks can't feed them. We are at millions of people unemployed, trying to get access to unemployment benefits, and the system is not set up to handle it. They're not even able to process them. We're talking about people that are 3 weeks away from receiving any degree of payment whatsoever to feed their families. And so there is a balance. We've got to try and achieve it. And I'm not a Donald Trump follower, and I need to put that out up front. I think he is absolutely ridiculous. And I think by the fact that he called for things to be open by Easter is the reason why people are still pushing back on any degree of reopening. But we have to do something. We have to recognize that we have in South Carolina, not in New York, not in Detroit, not in Chicago, but in South Carolina, where you still have as many as 5,000 empty hospital beds, that we have contained this to a great degree. We need to make sure that we don't have breakouts. Are the numbers going to get up a little bit once we reopen? Of course they are. But that will allow us actually to treat some people that need to get treated because they are showing symptoms and need to get tested. And I'll say this, if you think you need a test, stay home. Right. Do not go anywhere. Right. If you think you came into contact with somebody that is COVID-19 positive, this is not the time for you to be out and about because the store is open. You should stay home. But that applies if you have the flu. That applies if you have a cold or other contagious diseases. Right. This is that time. If you think you are contagious, stay home. Don't go out. Have somebody else bring it to you and drop it off at your door if that's what you need to do. But the rest of us have got to figure out how we can feed children, how we can make sure that our children that need to go to school can get an education, because we are falling woefully behind. And in my household, as on that meme, I am a lawyer, I'm a state representative, I can do a lot of things, but what I am not is a math teacher. What I am not is an English teacher. And I don't want to get tested any more than I already have.
Yeah. Alex Wright, we want to thank you for your question. Todd, I want to get back to the question about testing. Also, Yvonne McClintock Moats, thank you for watching. I'm going to get to your question and Cynthia's too, but I have to mention to Keisha Gillum, who's asking me to please get the baby what she wants. She has everything she needs. Let me just say that.
Anybody who has raised 2 kids understands that.
Right. Yeah. Just because she's screaming doesn't mean that she is being neglected. She has just eaten lunch. She has got water. She's got Yo Gabba Gabba, which is what she wanted to watch. She's mad because
So
she's in the
don't call
playpen.
DSS right
Please,
now. We are
exactly.
good.
That's what
That's
I'm
right.
sitting. The whole time you were talking, I hear word you say, I'm thinking, Lord have mercy, I'm gonna get a call from DSS. That baby is fine. She is fine. She is well loved and well fed. She's just mad, and she's
That's
a Leo, and because I'm not all up in her face right now. She done laid down. She got a thumb in her mouth. She's fine, everybody. She's fine.
There you go. There you
Okay.
go.
So listen, I know last week, Keisha said yes, LOL. I know last week that you mentioned the thing about testing, that you were going to have a call or some communication with DHEC and MUSC about testing, because we do need more test kits. Can you just talk a little bit about that?
So right now, the only call that I've been able to get through is to the hospital association, and that's where I got the most recent numbers from. DHEC is overwhelmed, and so I'll give them a moment as well as MUSC to get back to us on that. But I believe in terms of serologic testing for the antibodies, last that we heard, we were about a month out, and I don't know that number has progressed. I know that we are short on swabs, as is the rest of the country, because we have a president that believes that we are not, and he's going to leave it up to the states to do their job. I don't understand it, but that's his logic, which means it's no logic at all.
Right.
We need to get to the point where, again, we can test everybody before they go to work.
Yeah.
We need to get to the point where if a city wants to limit access to something, they're doing it based on science, not on religious bias, not on bias because of class or race. If they want to take people's temperatures, and that's how we're going to allow people to go into large department stores, then let's do that. Let's make sure that we don't have sick people accessing anything. But short of that, we need to start taking gradual baby safe steps in order to get reopened as quick as we can.
Well, I'm going to tell you, mention the thing about everyone taking their temperatures at Brookland, and I attend Brookland, and we're one of the churches that are doing the virtual services. Dr. Tasha Boone is at the door for every essential person, every media person, every 5-member praise team member, every pastor. You've got to come through her, take your temperature, do a little quick physical before you can go in the door. And it's not but, 10, 15 people there. So taking a temperature, not only that, but I just want to mention this too, it's face masks. I was out this weekend and I was kind of on Broad River and Lexington. I was one of few people who had on a face mask. And I did read something today that said South Carolina is among the lowest in all of the states that people won't wear face masks. Do you think people are just not getting it? They don't understand. They don't believe the hype.
So I have several face masks that have been in my car. I did wear it one time, and when I walked into the State House with it on, somebody said, "You look like you're here to rob the joint." Now, I don't know if that's me in particular or being a black man in society where, maybe that's the way that people think, and I certainly get it. To a great degree, it is also hot here, even though it's not here today. And face masks get hot, and they get hot very quickly.
They do.
And so I did see a number of older people that had them on, and that is certainly who needs to be protected right now, wearing face masks, wearing gloves. I think it's difficult for us to change and all of a sudden start doing something which we have been predisposed not to do. Mm-hmm. In my travels throughout the years, ever since SARS came out, anytime I saw people that looked like they were from mainland China or Hong Kong, or when I visited Hong Kong, people wear face masks. I mean, it's just part of their daily lives. We just have not gotten there yet. And it may be a hard turn to force people to do that unless the governor starts to mandate it if you want to go into some of these places. And that may be the way to make sure that people are wearing something that covers their mouth and nose.
Yeah, I think that's so important. I think that's one of those things that we've got to do, because when the country and the states do get back to whatever that normal is, it's going to be a new normal, and face masks may be a part of that. So yeah, it was it was hot, but I think that's a small inconvenience to protect yourself and others. Cynthia Watson says, is it the belief that South Carolina has reached its peak?
So given the hospitalization numbers, there is a belief that South Carolina could have peaked. However, the modeling numbers, because we went into social distancing so quickly, and because we never had that real uptick, I don't know that the modeling numbers are situated in order to address a situation where maybe we've just plateaued, and that plateau is in fact our peak. I certainly hope that it is. In fact, I don't hope that we've plateaued. I hope that we are on the deceleration phase of all of this because of the warm weather and because of the possibility that the virus has mutated, and those people that are asymptomatic, that are positive, are passing on a less virulent form of the disease and making it so that we will develop a type of herd immunity faster than other situations and other populations like in New York City, where they are literally in the death grip. And I think it's very important to remember that as our prayers and our thoughts to go out to the people of New York City and the people of every major city, and even in Florida, where you have major cities. Miami's a major city, Jacksonville, Daytona, Orlando. These are major cities. We don't have cities of that magnitude here. And I think that lack of density, in talking to a member of the Hospital Association this morning, I don't know that that lack of density was put into the modeling to begin with, which is why our modeling put us so high when our actual numbers are so low. Remember, we've still got 6,000 empty hospital beds, and to go from 100 or 277 up to 6,000, and that's 6,000 empty beds. That's a lot of people that are all of a sudden infected and hospitalized. And if you're given that basically 20% hospitalization rate out of all your positives, that's a lot of people that are all of a sudden going to test positive.
Yeah. Tanta B says Cuomo's wife didn't have any fever. Not all COVID patients have fevers. And you just spoke to that. That's the other thing. There are a lot of people that are asymptomatic. So, you don't know is he is or is he ain't. So to me, that's more of a case for face masks.
The face masks should absolutely be worn. And despite my ignorance and my inability to follow rules.
I mean, we all looking like terrorists out here. Okay.
Yeah. I should totally wear a face mask. I got a call from somebody who is a real big guy, former football player, who walked into the bank wearing a face mask and sunglasses. And he said, nobody looked up. And it is the first time in history that a black man can walk into a bank in South Carolina wearing a mask and shades and nobody think that he's there to rob the bank. So hopefully that thought process continues and we were able to do so safely and get rid of this disease.
It's funny because I like I said, I've been wearing them. I've got a couple like you, and I keep them in my car and wash them out and everything. But over the weekend, I think Saturday, I ran in. It was raining, and I ran in to Family Dollar or something, and I felt naked with it. I was like, oh my God, I don't have my face mask on, and I was like, I was holding my breath. I was like, I don't want to, I was holding my breath, talking to Dwayne Cooper. As a matter of fact, I was like, I can't. So anyway.
No, but it's very real. And that's how people should feel. They should feel naked without some type of protection, without hands, without gloves. And remember that the biggest thing is if you find yourself in a store and you didn't wear a mask and you didn't wear gloves, you need to wash your hands as soon as you can. That's how we're going to get through this. It is by people touching things and then touching their face. Absolutely. So touching things, it doesn't permeate the skin. It's that you then touch your face. Now, what I do find is going into stores automatically makes my face itch. I don't know why. And so I find myself, I don't touch my face any other time of day except when I go to Lowe's. And then I'm like, oh, God, here we go. So we should not do that. We should always be washing our hands.
Yeah. Isaac Wilson says, hello, Todd. Jennifer Reed says, yes, we need to pass the test before going back to offices. Absolutely. Keisha Gillum says she's going to hang up with DSS now. Thank you very much.
Where I come from, we call them snitches, but I know it's somewhere we won't do.
Right. Look, snitches get stitches.
That's right. Especially DSS snitches. They're the worst.
Oh my gosh.
Sorry.
I know. Alex says, thank you, Todd and Trey, for more of the conversation. Absolutely. Carolyn Sawyer says, have you found a testing center with PPEs?
So the PPEs are still very low. And I've been told again by all the parties that South Carolina is okay. Now, that also means, and these are numbers that we were given that are kind of off the top of my head because I didn't write it down, that a COVID-19 positive patient takes about 18 visits a day and uses almost 100 PPEs, the number of people in and out of the room.
Right.
And so that's the problem with it, is that it just drains our resources as it relates to PPEs. But what we also know for people that are not healthcare professionals, wearing anything over your face, wearing gloves, that may not be the ultimate in protection, but it is enough, hopefully, to make sure that we're not spreading this. And to Jennifer Reed's comment about being tested, we all should be tested. The fact of the matter is we're not going to be able to test people that are asymptomatic for a long time to come. And it's probably the president's failing. It's also the system failed. There was an article in the Post and Courier that dealt with DHEC asking legislators for years to fund this pandemic division that they had And I can tell you that the article was somewhat misleading. That request was probably made to either Governor Nikki Haley or Governor Mark Sanford, both of whom told their state agencies not to request what they actually needed, so that it would not appear that the governor's office was asking for a whole bunch of money. And so that was what the article did not say, that a great deal of the failings in this state, and as it relates to pandemic control and why DHEC is underfunded and why a lot of other things are underfunded, is because those prior two governors simply told state agencies, don't request what you actually need. And this isn't coming from me. I mean, this is something that Gary Simmel, the majority leader, has said as well. Governor McMaster has not put those same handcuffs on state agencies as the other two did, but because they did, that is part of the reason why we're here now.
But why would that be beneficial for the state agencies not to request what they need? Why does that look bad on the governor's office? And this may be politics 101, I don't know, but that sounds ridiculous to me.
So politics 101, when you were a Tea Party style governor, was to not make it seem as if the money you were requesting was more than what we had, when in fact it would have had to have been.
Gotcha.
We underfunded our pension system, we underfunded our prisons, we underfunded our schools. But if you were a governor, if you were a cabinet-based agency, you couldn't make it seem like the governor was asking for $2 billion when all we had to give was $1 billion, because you were overloading the agency with your budgetary request. And so they simply didn't. And we continue to try and make up that difference now, not just as it relates to DHEC, but with our prisons and everything else. And by the way, since we brought that up, prisons are one of the areas where we are truly underserving our population. We are down now in South Carolina before we passed sentencing reform, we were about at 25,000 total inmates in South Carolina. We are almost down to 17,000. We should be much lower than that. And the way to get there is, again, by sentencing reform and looking at doing this in a way that actually works. And why it matters now is because we saw this morning that a prisoner at Broad River tested positive. When you see a bunch of inmates testing positive that are sitting together, living together, and they can't leave, that is about as unfair as it can ever be. It seems to me to be unconstitutional torture to make someone sit there in close confines with other people who are catching and passing on a deadly disease, and one that we know is deadly, because we refuse to do the right thing about it.
Well, here's the thing. That was just one inmate. Well, we know what's going to happen now. It's going to be several more. Well, because before that, some of the employees had tested positive. So
absolutely,
it was bound to happen.
That's right. That's right.
Cynthia Watson and Tanta B say thank you for your response. Nicolette Robinson says team face mask. And also Katrina Bridget says the people perish for the lack of knowledge. The information is being given to the people. However, they're not gathering. They're not adhering to the pandemic. They need to stay home or protect themselves. The other thing is the whole distance of things. People are not, staying 6 feet away.
They're not, but here's the other side of that, Trey. And this is again, if you are grabbing the numbers and you're truly digesting them. And again, I'm not advocating that we go back to the situation that had existed pre-COVID-19, but I am saying that we have got to start exercising a degree of common sense as it relates to the numbers as well and the data that we have. Right now, if you started listening when the cities first started going into their shelter in place, which again I thought was illegal, but either way. And then when the governor did it, you've got a number of people in this state that have been quarantined for 6 weeks. We know that the incubation period on COVID-19 is about 2 weeks. So at some point, I don't know how long we're going to be able to keep people cooped up when they are armed with knowledge that suggests that if I've been quarantined for a month, why can't I have my parents over who have also been quarantined for a month and haven't left the house? And again, there is no logical response to that. There is an emotional response, but there's not a logical response. And that begins to be the problem. And again, I'm not a Donald Trump follower, but I am looking at the numbers. And the last thing that I'm going to constantly leave people with, and I tell everybody, grab a hold of a number that matters, and those hospitalization rates matter. Because the number of persons that are hospitalized and that have perished in South Carolina fit a paradigm that suggests that they are much older and had other comorbidities. Not that any death is okay, but again, we've got to get to the point where we are doing that balancing act, because if we don't, we're going to suffer. And again, as the majority population catches a cold, we catch pneumonia and die. And that has always been it. And if we're not getting stimulus checks, if we're not getting unemployment, then we're going to continue to perish because we don't have access to eat any other way.
But Todd, I can totally understand the social distancing as far as that's concerned. I already know my mother or my sister or somebody in my family, somebody in my neighbor, whatever. I know what's happening with them. But I'm talking about even in a line. I hear people say all the time they've been in lines, like at wherever at the DMV or someplace like that, and people have face masks and are packed like this.
Yes,
I think that's one thing to say. Can I social distance from my family because I know what's going on, but then social distance from a bunch of people that you don't know who they are, what they've been exposed to. I think it's two different things.
It is totally two different things. And I remember when I was in Target, a guy had walked to where he thought the line ended. And really, it was just the 6 feet of separation between the person he was about to get behind and the person behind them.
Right.
And he just, I guess, didn't believe that the line could have gone all the way down the block and around the corner from where he was about to cut in. And so that may have something to do with it.
Yeah.
But South Carolinians are typically a friendly people. Even amongst the racists out there, we've always been people that didn't mind standing in line behind one another. We simply have to do a better job and make sure that we are exercising that social distance so that we can stay safe. That does not need to go away. Yeah. When we are in public, we need to try and stay away from one another because catching this disease can be deadly. Yes. And so that needs to be, and it is a very, very contagious disease, and that needs to be said as well. But again, once we get to that point, we also, have to achieve that balance.
Yeah, but common sense is the biggest thing.
Right.
We've really got to take it seriously that this is a disease. It is highly contagious, but we've got to practice common sense. State Representative Attorney Todd Rutherford is with us. I'm Tre Tailor. This is Coping with COVID. Maxine Moses says, a doctor said today that you could get tested on Monday, but get infected on Thursday, get a negative test result on Friday. Knowing that, what can we do to protect ourselves?
Well, and the doctor is exactly right, because you could catch it today and have had no test, try and get a test on Thursday, and then test positive on Friday, and even though you still have it. But again, that's why we should focus on, if you feel the need to get a test, you do not need to go anywhere, whether you have been tested or not. If you lose your sense of taste and smell, you should not go anywhere, and
Absolutely.
You should try and get a test. And that is when you should start quarantining yourself for that 14 days to make sure that whatever you're feeling is real, and you need to act on that by staying away from other people. If we can do that, we can get through this. Those people that are feeling so bad they need to get hospitalized, they need to go to the hospital. They need to call them in advance and tell them that this is how they're feeling, that they have a temperature, and they should go. And once they do that, we can start isolating this from those people that have it and may be slightly symptomatic. Because again, that person that has it and is asymptomatic, they're probably not even going to get a test because they don't know that they have it.
Exactly.
But the science also suggests that what they are passing on to other people may be a mutated form of the disease that is also so mild that what they're passing on is something that other people don't know that they have either, and they're developing antibodies to it. But again, focusing on the raw data, 277 people hospitalized in South Carolina out of a total population of 5.5 million. Those odds are pretty decent that even if you ramp it up and go to the total number of 4,000, even though 2,500 thereabouts have probably passed the point where they're contagious and even would test positive anymore. If you use that 4,000 number out of 5.5 million, South Carolina is still doing okay.
Right.
Population density matters. We see that with New York, Chicago, Detroit. It matters. Staying away from one another matters. So again, take that into account. We all should still believe everything we touch has it. In any public place, it's there. When you go back in your house and you've been outside, wash your hands. Don't touch your face. Still continue to do that, but also understand that as the governor reopens things and as the government decides to reopen things, using those precautions should keep this disease at bay.
Attorney Todd Rutherford, State Representative for South Carolina, is joining us on Coping with COVID. I'm Tre Tailor. I want to thank everyone for watching. Jeffrey Johnson has given us both a shout out. Jennifer Reed says, you're right about prison reform. We also have to care for the homeless. As you said, that's a whole nother thing, which is truly correct, Jennifer. Now, this is going to be interesting. Alex Wright says, can you enlighten any of us as to why the quote, so-called big small businesses got 10 to 20 million, but they were declared small businesses?
So I went and argued with my banker this morning, and he argued back with me that it is not possible that banks prioritize who got this loan or not. And I told him that he was probably wrong. He assured me that that would not be legal, and I said, well, they're probably doing it anyway.
Right.
But banks are regulated by the federal government. I don't know what's going on. I don't know anyone besides Blue Marlin. He was on TV very early saying that he had gotten one. Other than that, I don't know what the deal is with these loans, except that this is a Donald Trump thing, so I don't expect that it'll be delivered on time anyway.
Yeah, Ruth Chris also, there was an article in the paper last week that stated they got $20 million. Now, I thought it was the Ruth Chris franchise, but someone told me that it was the South Carolina $20 million. So.
No, that was national.
It was national. I thought it was.
Yeah. And in fact, Shake Shack got $10 million, and they announced today that they are going to return $10 million to the system so that the system can give it out to restaurants that need it more than they do. Okay. And so, again, it's a Donald Trump system. Nobody should expect it to work the way that it's.
There are a couple of more comments that I want to get to, and a couple of more people that had some questions from last week, Todd. But Josephine Smith says she thinks that we should have a mandate to at least wear a mask to protect others, since you don't know who might or might not have it.
I agree. The only problem with that, anybody that saw the Instagram post of the black guy in maybe Chicago getting yanked off the bus by the police because he didn't have a face mask, we don't need that. And we don't need that because until the government is at the point where they are providing face masks to everybody, everybody can't go get one. I go out and I ride on dirt bikes and things, and so I had masks. But those people that don't, I wouldn't know where to tell you to go get one. And I'm not going to predicate your going back out into public on wearing something that you may not be able to get. Mm-hmm. That being said, tie a scarf, a T-shirt, a shirt around your face. Do something. Now, again, I acknowledge that everybody doesn't have that. I mean, this is the world that we live in. And unfortunately, a lot of people simply don't have access to those things. My office is right on Park in Elmwood. And so I am surrounded by a homeless population on a daily basis who either doesn't have access to that or because they don't have access to a house. Or if they did, sometimes have mental issues that prohibit them from understanding that that's what they should be able to do, and that's what they should do. And we should not cut off resources to people like that. And we've got to make sure that the rules that we are applying to people, that people are able to follow them. So I was driving around on Saturday, and I saw my county councilman, Paul Livingston, running up the street, and he had a face mask on, he had on gloves, and he had something in his hand. And so I went and I pulled over and I waited and I said, what are you doing? He said, well, there were some young ladies that were feeding homeless people and they didn't have masks and gloves, and he wanted to come give it to them. So he ran all the way home and ran back. Wow. And he couldn't find them. So I put them in the car and we rode around looking for them. We never did find them. But if we're going to mandate it, we have to do like my county councilman and provide it. Yeah. If we're not providing it, then it's hard to mandate.
Yeah. Carolyn Sawyer says you can make a mask out of a sock. Yeah.
You can, but I wouldn't use my socks, but you certainly could. Yeah, you certainly could.
Danny Velasquez says, thank you so much, Todd, for always looking out. Also, Carolyn says the SBA legislation has loopholes. I think everything does, right?
Everything in government does. And people get paid, lobbyists get paid to create those loopholes for whatever benefit of whoever they're trying to do it for. I'm sure that this one does. And I'm sure that, again, if it came from the White House, it is going to benefit the rich and the wealthy because that's seemingly how things come out of it.
Yeah. A couple of more things, Todd. Stay at home. I know the stay at home order is still going to be in place despite the openings. Now, to me, I mean, again, how are you going to tell people to stay at home? And you got department stores, flea markets, and we've been home, and now everything is open. Not everything. Look, we can go out. Our hair won't be. We're going to look busted when we go out. because the hair salons and the gym's not open.
But you know, Trey, I am one of those cheap people that cuts my own hair, so I ain't got that problem. And I ain't got that much
are you taking clients?
I did. My 2 sons, and both of them complained because it took me an hour to do it, and it wasn't necessarily right. But thankfully, they weren't seeing anybody. But yeah.
Yeah, so the stay-at-home order is still in place. And also, you still have to eat outside of the restaurant. So those 2 things will stay in place, despite the fact that department stores, flea markets, florists, bookstores, music stores. Now, what about salons and gyms? Do you know what the plan is, the governor's plan is for that?
I don't. And I am talking to some restaurant owners, John Sears at Hendricks, about what it would take for them to be able to reopen. And I am one of those that believes that we have got to get restaurants open sooner rather than later, because so much of our population works behind the scenes, typically in restaurants. And one of the ways that we talked about was when the state is ready and as safely as possible, making it so that a restaurant can only reach 50% of their capacity, that the entire serving crew would have to wear masks. And those people that are in touch with food would have to wear masks, doing things, separating bar stools, doing things like that can allow a gradual reopening. Because again, we've got to get to the point where we are taking those baby steps. If not, we can't continue to live like this. No one can. No one can.
Mm-hmm. Yeah. Merrill Johnson says that if you're an organization seeking masks for essential employees, please submit a request to the Samaritan's Purse. The Seamstress with a Purpose. She's on a Facebook group. So please definitely
Seamstress with a Purpose.
Right. Seamstress with a Purpose. Yeah. Also, we had a question from who is this? June, I can't read my own handwriting. Michael McCullough says, when do you think tourism is going to come back to the state?
I think that, quite honestly, it's going to be a while before we can start accepting tourists. As much as I've said about us reopening, I did not include reopening for people to come down from hotspots. I don't believe that they should do that. I don't believe we should accept them. And so until testing gets better and numbers get better for them, I think my words are going to have to be contained for the people that are living inside of South Carolina. Okay. Other than that, I mean, there's no way to allow people from Florida and New York to come to South Carolina. They all should want to, but they should simply not be allowed to until they can get over this, even though I believe that we have done a pretty good job here.
Cynthia Watson wants to know, what about June primaries? What do you think about that? Do you think this should be postponed?
It's kind of a wait and see, and I personally think that they should be postponed. But it's a wait and see to figure out kind of where we're going to be. I think a lot of us, and we spoke on this last week, think that America is the greatest country that has ever been in this world, period, and that our ingenuity is going to make it so that, and I just feel like this, one day we're going to wake up and somebody's going to have a cure. They're going to have a vaccine, because that's the way that our world has worked thus far. Now, again, maybe I'm pie in the sky, maybe I'm being ridiculous, but I feel like that. And because I do, I think that at some point in the near future, and I don't know, I'm not willing to say what that is. I'm not Donald Trump going to make it, when he said Easter or whatever, but I just feel like we're going to be able to get through this, and we're going to do it together. But until then, we simply have to stay away from it.
Alex Wright wants to know about his new business. He knows that, we do know that mortgages and rents have been furloughed. What about business?
Well, wait, hold on. Let me slow down. Mortgages and rents still have to be paid.
Right.
So go pay your rent and pay your mortgage.
If you have the money.
Right, if you have the money. And if you don't, work it out with your lender. Don't just not pay it.
Right, absolutely.
And someone was asking me the other day about evictions. Evictions have been put on hold, but paying your rent has not been put on hold.
Gotcha.
And if you don't pay your rent when we come out of this, then you might be evicted. So please try and work out something with your landlord as to how to pay your rent and how to pay your mortgage. Now, I don't know what's going to happen when all of a sudden the Supreme Court, through Chief Justice Beatty, who acted very quickly on this and stopped the evictions. I don't know what's going to happen when all of a sudden that opens back up. It's going to be a flood of applications for people to do evictions. And so I hope that we can get this economy back up and running so that those people that can't pay it now are going to be able to pay it, because we can get them back to work.
Danny Velasquez says he purchased a vehicle. The tax office says that they are accepting calls Monday, Wednesday, and Friday. However, for the last week, he can't get anyone to answer. Will the police bother him if he can't pay the taxes to get a legal license plate? He says he does have his bill of sale and proof of purchase and insurance. What are your thoughts?
No, I can tell you, as long as you are around Richland County and the city of Columbia, that they are, by and large, not bothering anybody for anything unless it's a call in progress. It's a crime being committed actively. That everybody understands the shape that we're in and the system that we're dealing with. And so you would not typically, and again, 99% of the time, have any problems with that. But, if you drive down to Folly Beach or Mount Pleasant, where they're operating what I believe are illegal roadblocks, you might have a problem.
Yeah. Attorney Todd Rutherford.
I can't pay my electricity bill. I've been going to Virginia trying to pay my electricity bill, and I can't get paid either.
I'm trying to get Sesame Street back on. He is a state representative. He's a state representative, and he has joined us on Coping with COVID. Thank you all so much. When will the tax office, I think this is, Siobhan Meyer said, will the IRS be back open to accept calls? She wants to hear from the IRS. All right.
I don't know. And, most people, they don't ever open back up unless they're sending money. But I don't, the federal government is something that is not under my purview. I'm not really sure what they're doing. Yeah. And I apologize for that.
Oh, yeah. Merrill Johnson says anyone that needs some help with bills, they can call United Way 211. And 211 is definitely a resource. I'm trying to get an interview with those folks, too. 211, if you have some problems paying your bills, please call 211. Danny Velasquez says, thank you so much, Todd. You're always looking out. And Merrill says he's coming to get his hair cut by you, Todd. You might want to do a little barbershop on the side. You may want to do a little side hustle, man.
I don't think anybody would pay me to cut their hair. Trust me.
So, all right. So, Todd, we'll hear from the governor a little bit later on this afternoon. He's been doing his 4:30. He's been doing his 4:30 press conferences, and we look forward to hearing back from him then. And, we'll find out kind of what's going on as far as that. Again, I guess in summary, you say what?
I say that watch the numbers, pay attention to the data, pay attention to what the hospitals are saying about inpatients, and look for those upticks, and also look for the downticks to see kind of how South Carolina is doing. If you feel like you are positive, do not go out. If you have any symptoms whatsoever, do not go out. Call somebody and tell them that you're symptomatic and you're going to need help for the next 2 weeks, because that's what we have to do. We have to stay away from one another, and we have to look at getting back into society as a norm as quick as we can, as safely as we can. So, And again, thank you so much for doing this. I appreciate everybody that's written in and called in.
Absolutely. One last thing. We did get a comment last week. I mentioned this to you off the air. Anthony Beckworth is in Kershaw County, and he is having some problems with what he says is racism, and he is having some challenges getting an attorney. Can you give him some advice?
Anthony, you certainly can give my office a call. We'd be happy to help you out. And you would not be the first person to complain about racism in Kershaw County. I just want to say that off the bat. But it should not exist anywhere. We should work as hard to stamp that out as we are working hard to stamp out COVID-19.
Don Hambrick just logged in. He says can I say damn? I guess I can. It's a damn shame that under the governor's current policy, you can purchase liquor, beer, and guns, but a barber and beauty shop is not considered essential. Don says, you can tell who some of his principal donors are. Maybe maintaining good grooming is not one of his rules.
Well, this is South Carolina, and being able to buy liquor and have your gun at the same time is very important, and apparently ranks in the top 3 constitutional amendments. And so as such, I do find it amusing as well, but hopefully we are going to open more places so that these business owners can stop filing for unemployment and stop waiting on the federal government to deliver something that simply I don't even know is coming.
Yeah. Jeffrey Johnson says, thank you for sharing information and trying to do the best you can. Cynthia has asked that you come back on later this week. I don't want to bother Todd every day, all day.
That's fine. It's time.
But I'd love to have Todd back on. We're also talking to a couple of other state representatives to have them on also, so that we can hear from the people that we put in office.
That's right.
To help us navigate through this time. Again,
Absolutely.
as Todd said, thank you all so much for joining us for another Coping with COVID segment. As a matter of fact, Merrill Johnson has been on the line. He's getting ready to go get his haircut with Todd so that he can be on the show later on tonight.
He'll be suitable only for radio, not for video,
Merrill is with Mercy, and he's going to give us some resources for mental health. This is stressing a lot of people out. And
yes,
I had Cheryl Williams with Agape Christian Counseling on last week, Todd, and she gave us some great tips. And Merrill is going to give us some great resources that Mercy has also. As usual, I always end with an excerpt from Jesus Calling. Today is April 20th. And today it says, "Do not be afraid, for I am with you. Hear me saying, peace be still to your restless heart. No matter what happens, I will never leave you or forsake you. Let this assurance soak into your mind and your heart and be filled and overflow with joy. Though the earth gives away and mountains fall into the heart of the sea, you need not fear. The media relentlessly proclaims bad news for breakfast, lunch, and dinner. A steady diet of their fare will sicken you. Instead of focusing on fickle, ever-changing news broadcasts, tune into the living word, the one who is always the same. Let scripture saturate your mind and heart, and you will walk steadily on the path of life. Even though you don't know what will happen tomorrow, you can be absolutely sure of your ultimate destination. God says, I hold you by your right hand, and afterwards, I will take you to glory. Todd Rutherford, amen. Thank you so much once again for joining us. Have a wonderful day. Thank you for joining us. Please continue to like and share and post this great broadcast with all of this great information. Please follow me on Facebook on my personal page, Tre Tailor. It's two of them, Tre Tailor. And then I also have a professional page, Tre Tailor, so you can stay up to date as you and I all cope with COVID. I got to get back to these babies, man. So,
all right, do it. Thank you so much.
I'll talk to you later. Thank
all
you.
Right, take care.
Thank you all.
Bye-bye.